Rosalynn Carter has dementia. Her family revealed the news last week. It is the latest health battle facing the former first couple who've been married for almost 77 years. Earlier this year, it was announced that former President Jimmy Carter began receiving hospice care at home. Natalie Brand has the latest.
I love you all very much.
Almost 2 years since former President Jimmy Carter and his wife Rosalynn celebrated their 75th wedding anniversary comes word of another health challenge facing the couple. In a statement, the family revealed the 95-year-old former First Lady has dementia and continues to live happily at home with her husband.
So what happens when you have dementia is that more and more often you cannot do what you can normally do as part of your life, remaining independent.
Robert Egge is the Chief Public Policy Officer of the Alzheimer's Association.
You become dependent on others and support as you forget things like how to navigate your way through life, whether it's literally driving your car becomes something you can't do anymore, or just getting yourself ready for the day.
According to the CDC, more than 6 million people in the United States aged 65 and older have Alzheimer's disease, which is the most common type of dementia. Advocates praise the former First Lady for raising awareness with her diagnosis.
It underscores for all of us how important it is to reach out and get help and support that we need, and that nobody should go through this journey on their own.
The news comes more than 3 months after the family announced that the ailing 98-year-old former president decided against further medical intervention and began receiving hospice care at home.
You may have missed the statistics, but 6.2 million people 65 and up are living with Alzheimer's today. There are estimates that the number could be more than double by 2060 if nothing is done to prevent, slow, or cure the condition. According to the National Institute of Health, with all of those stats, the CDC says minority populations are expected to be the most affected. They say conditions like heart disease and diabetes increase the risk of Alzheimer's. In general, women are nearly 2 times more likely to be affected by Alzheimer's than men. The CDC says the difference is primarily due to women living longer. For families impacted by dementia, their loved ones are so much more than just a number. After learning about the former First Lady's diagnosis, many people are praising her for the awareness that she's bringing to the condition. Camilla Williams talked with one woman who says she wishes she knew about the resources that were out there far sooner.
When he was diagnosed with dementia, it was something that I didn't know anything about.
Heaven Smith says her father's diagnosis was a challenge to navigate.
One day he would know me and the next day he wouldn't.
Her first best friend, Robert, the man that would help anyone.
He would pay for people's groceries at the grocery store.
Was put in a nursing home 3 years ago in California. She says hearing the news of former Lady Rosalynn Carter was disheartening.
It's depressing. It's hard on everyone in the family. You go from knowing your family to just not knowing anybody at all.
So what help is available in Central Georgia when a family relative shows early memory loss? The Alzheimer's Association in Macon can help. Catherine Colcom with the Alzheimer's Association says they offer support and education for free,
including the signs and symptoms, but also providing care and planning for the future after a diagnosis.
You may hear some people say someone has Alzheimer's or they have dementia. They are different.
Dementia is an umbrella term for forms of dementia, and Alzheimer's disease is the most common form of dementia. It's about 60 to 80% of all dementias.
Smith told me her father died in November, but she has a way to remember him.
We named the baby after my dad, so we named him Robert Enzo after my daddy, so to carry on his legacy.
A legacy.
He's a sweet baby.
No one will ever forget.
Experts urge people to go to the doctor if they think that they or a loved one could be experiencing a problem. The National Institute of Health says some early warning signs include memory loss, poor judgment and confusion, difficulty speaking, expressing thoughts, reading or writing, getting lost in familiar areas, trouble handling money responsibilities, repeating questions, acting impulsively, and balance problems. There is no cure for Alzheimer's or other forms of dementia. Drug makers are working around the clock to find a fix. The FDA granted accelerated approval to an Alzheimer's drug earlier this year. The new drug shows the experimental medication modestly slowed the disease's progression, but Jared Hill shares why critics question whether the benefits are worth the risk.
Alzheimer's patient John Teeling is feeling optimistic about a treatment for the mind-destroying disease.
Anything's good, isn't it? Anything that can delay it or give me hope, yeah.
New research from the makers of the drug lecanemab shows it modestly slowed disease progression by about 5 months in early-stage patients.
It boils down really to one thing. That is more time.
In a statement, the Alzheimer's Association says it welcomes and is encouraged by the data.
A person in the earlier stages of disease has more time to enjoy with family, enjoy remembering who they are and who their family is, going on vacations, maybe going to one graduation, having a wedding, experiencing a birth.
Side effects include swelling, which was seen in about 13% of recipients, as well as bleeding in the brain.
There are very few options for people with Alzheimer's, but some health experts are concerned that the modest benefit of this treatment may not outweigh the risk.
So it's a very, very small, almost imperceptible rate of decline change. You really have to look closely and say, is the benefit worth the chance of side effects? And does the benefit actually improve the quality of life?
The FDA controversially approved another Alzheimer's drug called Aldahelm, despite questions about the risks and benefits, but many doctors and insurers are not prescribing it.
For now, the former First Lady and family is living happily at home. The Carters say that Jimmy and Rosalynn are spending time together. And as for the former president, Jimmy Carter began hospice care in his Plains, Georgia home in February. Family members say he remains in good spirits, follows public discussion of his legacy, and is enjoying regular servings of ice cream.